Hello there. Welcome to the World of Sustenance where your academic needs are met. We don't come again. Make we try look another aspect of our lecture series on maternal and child health. Okay, what we have today is the disorders and complications of pregnancy. There are two types of this. There are major and minor complications or disorders associated with pregnancy. Please take note. So this topic is a very interesting one because during pregnancy they get minor, they also get major complications involved during this process of gestation or pregnancy. So let's go right into it. As you can see here, you can see this a lady here showing that is happy, a lady that is happy and she's actually showing concerns about her health and everything. While on the other hand, this is a lady where that is showing serious concern about her health, how her baby is growing and how she's doing. You understand? So what comes to mind? Take note during the process of pregnancy. It is always an important thing to note that there are certain things that might happen during the process of pregnancy. There's some disorders or there's some complications or ailments that can happen during the process of pregnancy, and some of them they are just minor, while some of them are major, they are serious, right? While some are minor, okay, just normal thing. So let's understand these different types of the disorders or complications associated with pregnancy. So first of all, we'll start with the minor disorders of pregnancy. We just highlighted about 5 here, but there are a lot of them, a lot more than this. One of them is morning sickness. This is one of the most common types or common disorders associated with pregnancy as a minor one. So for the morning sickness, it has to do with that's nausea and vomiting. You understand? So that's what happens during the early stages, usually in the first trimester of pregnancy. And what is the main cause? I have to do a table here to actually show you the disorders and the major cause or causes of the exact disorder. The other causes too, mind you, but these are the major ones. So the reason for this, or for the nausea and vomiting, which is the morning sickness, is hormonal changes. Because at that early stages, different hormones are coming up, especially progesterone, the pregnancy hormone, coming up to help make sure that everything in the woman's body is in order for the proper health or the growth of the fetus. The heartburn, on the other hand, now is another important minor disorder. So what is the reason for this? This is as a result of the relaxed cardiac sphincter. Cardiac sphincter is the ring of muscle that separates the esophagus and the stomach. During early stages or during pregnancy, there can be a minor, or there can be feeling of heartburn. You understand? That's feeling that something is burning in your throat. You understand? So that's as a result of the fact that food, as you know, the stomach is filled with gastric acid, can come up, like go back into the esophagus, because the fact that the muscle there, which is the cardiac sphincter muscle, have been relaxed. You understand? Because of the presence of hormones still. Very, very important. So moving on, let's quickly look at this topic and try to digest this quickly. So constipation, on the other hand, constipation means difficulty in passing feces or moving the bowel. So this is as a result of reduction in bowel motility. You understand? Why is this the case? This is because of the presence of hormones too. Very, very important. They go there, they cause, they affect the motility of the muscles there. Very, very important. The next one is that's the frequency of urination. There's an increased frequency of urination, especially during the early stages and also the late stages. Early stages because of the presence of hormones. You understand, like the progesterone. You understand. Then the late stages because of the fact that the growing fetus or the big fetus or the grown fetus is pressing on the bladder, which causes increase in the frequency of urination. Very, very important. So moving on, the frequency of that's the backache. Now on the other hand, this is as a result of postural changes. You understand? When the woman changes posture because of the growing fetus, the man might actually bend forward or bend backwards so as to be able to carry her body. You understand? At that stage now, she's not just carrying herself, she's carrying herself and a growing fetus. So there might be some sort of prostration, which will definitely cause backache. So very, very important. So moving on, major disorders of the pregnancy. Now, when you think about this, like if you remember the minor disorders, they are like, okay, they're just normal thing that will happen. You understand? They are normal, they are annoying, but they are normal, that I've pointed out before. But for these major ones now, they are dangerous and they need urgent care. Very, very important, very, very essential. You understand? So for the first one is anemia. Anemia is a normal thing because during pregnancy there's increase in blood volume, and therefore there would be a need for a corresponding increase in the amount of red blood cells. But in the case of anemia, the amount of red blood cells are they are not enough. They are inadequate. So there will be anemia. That's what it means. You understand? Increase in blood volume and not enough red blood cells being able to meet up the increase in blood volume. That will lead to anemia. And the reason for this is iron deficiency. You understand? Because it's iron that is required in the process of heme biosynthesis or hemoglobin biosynthesis or production. So iron has to be provided to actually address the situation. So the next one is the pregnancy-induced hypertension. From the name, pregnancy-induced hypertension. This means during pregnancy, there's a tendency that there will be increase in the blood pressure. You understand? Increase in blood pressure. This actually happens around 20 weeks of pregnancy or gestation. About 20 weeks or after 20 weeks. You understand? This is like a spectrum of complication. You understand? Under this pregnancy-induced hypertension, we have preeclampsia, we have eclampsia, we even have other ones too, even gestational diabetes too. Also, those can also be featured under this pregnancy-induced hypertension. You understand? From the name, pregnancy-induced means that the pregnancy is causing increase in blood pressure. Very, very important. So for the next one, which is the preeclampsia, it is a pregnancy-induced hypertension, but alongside there is also proteinuria. You understand? It means that there's increase in excretion of protein. You understand? So this is a very serious complication because this can be classified into three important clinical triads. They include the hypertension, proteinuria, and also edema. Such a woman that has these three classical signs means that the person is at a high risk of suffering from preeclampsia. You understand? Very, very important. You understand? So, but when there's a severe form of this case, it's called eclampsia. From name preeclampsia, before eclampsia. Then eclampsia is like the Oga. Oga means that there's a severe form of the preeclampsia. You understand? So the important symptom here is the presence of seizures. You understand? Which can actually lead to complications and affects the baby and even the mother too. You understand? This is one of the major causes of complications in pregnancy and can also lead to death too. So the next one is the placenta previa. Placenta previa, from the name placenta previa, placenta is occurring or is present at the cervix. You understand? The internal os of the cervix. You understand? So this is a very, very important complication or disorder or major disorder of pregnancy, because in that kind of case it can cause obstruction of the fetus during labor. You understand? And in such a patient, you cannot undergo. Please, very important. This can be very useful for your exams and everything. Do not subject the patient to vaginal examination, because this can rupture the placenta, because it is present at that cervix. It can cause further complications such as hemorrhage, severe hemorrhage, so bleeding. So this has to be addressed. Very, very important. So like I used to do, I almost always give a question to actually buttress what I've been taught so far. So a client at 10 weeks gestation calls the clinic reporting nausea and vomiting. Which finding would indicates client has progressed from normal morning sickness to hyperemesis gravidarum, requiring immediate evaluation. A. Vomiting once daily in the morning. Mild food aversion to certain smells. C. Weight loss of 7% of pregnancy weight with ketonuria. Nausea that involves after eating crackers. So which of these now? Because the one I said before, I explained one of the normal morning sickness, which is a minor disorder of pregnancy, but it can graduate to hyperemesis gravidarum, which is a very severe form of morning sickness. So I don't. This is an assignment. Go home and, or just when you have done with the video, do your research. If you have an answer for me, you can put it in the comment section. So thank you very much. I appreciate. Don't forget to like, subscribe, share, and to expect more videos like this. Thank you very much.